My name is Bethany Johnson. Today's date is July 15th, 2021. Today I have chose to discuss the endocrine system. I will also be showing you some images courtesy of Visible Body of the organs that make up the endocrine system, and I will be sharing with you a disease that is often contributed within the endocrine system. So first I would like to just get started by what the endocrine system is and what it does. Well, it actually controls most of the processes within the human body, some being from growth to sexual function. The endocrine system is actually very much responsible for regulating bodily functions through the release of hormones, and that is what the endocrine system does. So now I will be sharing with you the organs that make up the endocrine system. I have the thymus here in the blue here, and what the thymus is actually located in the upper anterior portion of the chest, and it's actually directly posterior to the sternum and in between the lungs. I have the heart is another organ that makes that up, and this is the sternocostal section of the heart. And then there's another surface, it's the diaphragmatic surface of the heart. Whole section is the heart, but this is just the diaphragmatic section. Next, we have the male gonads, and the male gonads are actually called testes. And these are these blue right here. So we would have the left and then the right. And these are actually responsible, or the primary male reproductive, or responsible for male sexual reproduction. And they are actually make the sperm as well. The female gonads are right here. We have two of them, one and then two right here. And this would be the fundus of the uterus that they are attached to. These, again, would be ovaries, the female gonads, and these are the primary female reproductive organ, and they are responsible for producing oocytes or eggs. We have the pancreas right here. So we would have the head of the pancreas, the body of the pancreas, and then the tail of the pancreas. And of course, and that's kind of lies medial to the kidneys there. You have both of the kidneys. Next, it looks like I have a picture of both of the kidneys, again with almost like caps that are actually called the adrenal glands. They kind of look like this goldish pyramid. And these are, again, they're situated superior to the surface of the kidneys. The parathyroid gland or organ is actually lies posterior on the lateral sides of the thyroid. So if you were able to flip this image around anteriorly, you would see the thyroid. So there are two superiors and two inferiors of that, so 4 total. And here's an anterior portion or view of the thyroid right here with this butterfly shape. Then we have the pineal gland. The pineal gland is very important because it actually secretes melatonin. And some of you actually might take a melatonin supplement to actually help you sleep. So the pineal gland is actually very important for regulating that hormone. The last two images I'm actually going to show together, so you can actually get a little bit better view. But what I have here in blue is actually the pituitary gland, and then this one I'm going to show right next to it, or put these both together, I guess I should say, so that way you can kind of see it a little bit better. This is the hypothalamus right here, and then like I said, this is the pituitary gland. So you can see part of the pituitary gland down here. Kind of hard to see the hypothalamus because this lady or man's hair is kind of over that section, but it actually is attached. The pituitary gland is actually attached to the inferior portion of the hypothalamus. So that's why I wanted to show these together. And then next, I'm going to be sharing with you a common disease that can often be contributed within the endocrine system. So I chose to discuss about Graves' disease. Graves' disease is actually an autoimmune disease. Your immune system, which normally would protect your body and help fight off diseases or pathogens that you come in contact all the time, ends up producing antibodies that actually attack the thyroid gland. And these antibodies act like TSH, or in the medical field we call it thyroid stimulating hormone, and they actually cause the thyroid to make too much of the hormone, and which in the medical field we would call hypothyroidism. The thyroid is actually, again, like I said, a small butterfly-shaped organ, and it's actually located anterior to the trachea and inferior to the larynx, or like some people would say the Adam's apple. Thyroid hormones actually control how our bodies use energy, and so they can affect nearly every organ in your entire body. Thyroid hormones are very, very important. Graves' disease is actually the most common cause of hypothyroidism within the United States. And I thought that was very interesting because a lot of people haven't heard of Graves' disease, so I thought that was interesting that it was actually the most common cause. I thought a fun fact that I learned was that Graves' disease actually affects 1 in 200 people. And it usually affects people between the ages of like 30 to 50, I learned, but it can happen at any age. The disease is even 7 to 8 times more common in women than it is in men. Researchers really aren't sure why some people develop Graves' disease, but it is thought to be from a combination of genes and outside triggers, such as any type of viruses that they may have come in contact with. A person's chance of developing Graves' disease increases if other family members have it. Some, but it's not. It has not been linked to that. So there might be some hereditary involved with Graves' disease. But what are some of the symptoms? Some of the symptoms of Graves' disease would be fast heartbeat, which in the medical field we call tachycardia, an irregular heartbeat, which we call arrhythmia, frequent bowel movements to end up leading to diarrhea, a neck goiter, which would be a neck enlargement of the thyroid within the neck. So you would see this big goiter on the outside of their neck. Heat intolerance, any type of muscle weakness. So those are just some of the more of the common symptoms or signs and symptoms of Graves' disease. If Graves' disease actually is left untreated, it can cause very, very serious health problems like thinning or weakening bones, which we would call osteoporosis, and it actually can develop into an eye disease called Graves' ophthalmopathy, which causes double vision or diplopia, and also eye pain. And it also can kind of, and with the Graves' ophthalmopathy, I think that's how you say it, ophthalmopathy, it causes the eyes to look bulging, like outwards, and that is actually caused by a buildup of tissue from all the inflammation, and so all this tissue and fat builds up from the inflammation, and it's behind the eye socket, so that's what causes the eyes to protrude forward, like in a bulging fashion. Diagnosing of Graves' disease is normally based on your signs and symptoms by your practitioner, and any types of findings during a physical exam that your doctor would normally do. If you think that you have it, you would go, obviously, or just your annual checkups. Your doctor also may order tests to confirm the Graves' disease. And some of the tests would be like a radioactive iodine uptake test. And what that actually does is it measures the amount of iodine within the thyroid and how it collects from the bloodstream. And then also a thyroid scan. And the thyroid scan would actually show where the iodine is actually distributed within the thyroid. There is 3 different treatment options for Graves' medicine, or for Graves. One being medicine, radioiodine therapy, and thyroid surgery. Radioiodine therapy is actually the most common treatment for Graves' disease. And what you would do with that is that you would just take that PO or by mouth as just like a pill, as a capsule, or like a liquid that you would drink. And then also an anti-thyroid medications and any type of beta blockers, again, to help with that tachycardia or arrhythmia. Surgery, like I said, surgery as a treatment is really rare for Graves' disease because that would obviously involve removing the thyroid. And another fun fact that I actually learned is that once that thyroid is actually removed, then you end up developing hypothyroidism and end up having to take thyroid medications for the rest of your entire life. So I think that a lot of the times doctors and surgeons do not want to go that route unless the radioiodine therapy is not working, or any other type of medicine. But again, surgery is very, very rare with Graves' disease and most likely the last resort. So thank you very much for watching. I hope you learned a little bit about the endocrine system.